The content presented in this medical lecture video is intended for educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of content presented in this video. Reliance on any information provided in this video is solely at your own risk.
Greetings from Trishla Foundation. I am Dr Vikash, your physician from Prayagraj. So what my lecture was going on the adult issues in CP patients. So we have covered in previous lectures like gastroesophageal system, GI system, then we have covered the cardiovascular system, and now in this third lecture I am going to cover about the respiratory system, the chest system of the adult, where the issues can happen and what issues can be there, what prevention can be done, and what is the treatment for particular issue. So let's start. So respiratory disorder is a complex issue in adult with CP. It is very complex, so understanding it, diagnosing it is very important. Because of deformities, because of lack of exercise and other issues, it is very common. So it occurs because of spasticity, muscle weakness, gastroesophageal reflux disease and dysphagia. So these are the issues which can create respiratory symptoms, and more common in dyskinetic CP, less functional, gross motor function जो system है, what system is there in those kind of patients, or intellectual disability patients, we generally see such kind of respiratory issues. So this is a leading cause of death in children and young people with CP if respiratory illness had happened. So this is what you have to keep in your mind, that it can cause death also. So don't ignore it, don't miss it. Just try to diagnose it on time with the help of your doctor and treat it as early as possible. So for adults with CP, death from respiratory illness is 14 times higher than for their peers with no disability. So can you imagine 14 times higher risk is there of death? So that much of criticality can be there. So this has to be tackled on time. Treatment of infection should be managed without delay. Whatever infection you find, your doctor find, you just go to your doctor, have some medicines, and it will be okay with time. But don't delay it because it can create further issues. So goal of prevention and treatment is to improve longevity and quality of life. And if the treatment is on time, definitely the longevity will be very high, very long, I mean. So we have discussed some issues which can create this respiratory problem. We have discussed the respiratory issues which can happen, and some screening processes and what we can do in prevention and treatment of this disease. So a brief about the risk factors once more time. So aspiration is most important risk factor. Aspiration, that any kind of fluid in your tummy or stomach, it can go into the respiratory system in chest, and it can cause kind of infection, kind of disturbances in the gas exchange, and further respiratory distress or maybe issues in breathing. So this is very important risk factor. Then oropharyngeal dysphagia, I mean swallowing difficulties, that can also create some issues. Uncontrolled seizures, if the fits are coming, seizures are coming, they can create issues in respiratory system. Then gastroesophageal reflux disease, I have discussed in first part of this lecture, this series. So you can go there and you can see my video there, that gastroesophageal reflux disease is very important issue in gastroesophageal system, and it is also going to affect the respiratory system. So it's very important to tackle this on time also. So frequent symptoms like having a daily cough or weekly wheeze, phlegm or gurgly chest, these can be there very frequently. Then one hospital admission for respiratory illness in previous year, if it is there, this history is there, this is very significant. So any hospital in past 1 year, or maybe 2 courses of antibiotics for chest infection in last 1 year, this is very important to note out. If there is something like that, you have to be very careful about the further coming years and further complications, so that we can prevent it early. Then mealtime respiratory systems like gargling, voice, wheezing, coughing, sneezing, choking. So these can also be there during mealtime. So those symptoms can also be avoided with proper advice. Then snoring every night, that can also be a risk factor for respiratory issues. Etiologies, coming to etiology, so repeated pulmonary aspirations, 80% of which are silent. So aspiration is done, and after some time you see that there is an infection or there is issues in respiration, breathing, and you find it that something had happened beforehand. So it can lead to chronic lung disease. That's why it is very important to note that aspirations are very common and it can affect very frequently. Chronic airway inflammation like asthma, poor airway clearance, impaired lung function, recurrent pneumonias, restrictive lung disease, and respiratory failure. So these are the common etiologies by which your respiratory system can be affected, and you can suffer from some respiratory issues. So what preventive measures we can apply? Prevention of aspiration is very important. So what proper posture is there, proper feeding pattern and everything I have explained in the first part of this series. So that lecture you can see once more, and you can have those preventive steps for aspiration. Then maintenance of oral health I have already discussed in that lecture also. Improvement in immunity. So what immunity boosters are there, like different kind of food items, your proper physical health and proper weight. These are going to improve your immunity. That can also be a preventive step in this kind of issues. Then check muscle exercises. If your muscle strength is very less, then you can go for chest muscle exercises with the help of your Trishla Foundation, and we can improve the chest muscles strength, and we can prevent the respiratory complications. Then yoga and different breathing exercises are there which can be easily done at home also. Then how to have a good posture, then maintenance of health, timely screening of asthma and other issues, whatever happening since childhood or maybe some other later stages, those screening are very important. Then vaccination, yes, vaccination is something very important, like influenza, pneumonia. These kind of vaccines are very important at certain point of time, and they can prevent respiratory complications. So don't forget about infections, ask your doctor and go for the vaccination at right time. So mealtime management strategies aim to prevent, reduce cough, wheeze, aspiration and choking. So at that particular point of time, patient should be standing or maybe sitting properly in good posture. And then small meals, semi-solid or maybe thick liquid, those can be preferred. And if he is not comfortable, you can go for liquids or maybe rice tube feeding to avoid these complications. Then intermittent suction can be there if there is chance of aspiration. Chest physiotherapy and treatment of infection and airway sensitivity. These are the other things which can be done to prevent the further complication. So postural drainage, annual checkup, treatment of G reflux, treatment of oral infections, treatment of feeding difficulties. So these are the all criteria, all the parts, all the points to be taken care of while managing respiratory issues in such cases. Treatment of cold infection on urgent basis. Yes, this is also very important. Whatever infections are either mild, either maybe a bit of severity, you should not ignore it and you should consult your doctor and go for the proper treatment on right time. Then use of proper inhaler for asthma as per advice of your doctor to prevent the exacerbations of asthma, and urgent treatment is required in respiratory emergency. Any kind of breathing difficulty or choking or something like that, aspiration, you should rush to the hospital, rush to the emergency department and get the treatment done at the right time. And whatever ICU care will be required at that time, you should avail these facilities on right time to prevent further complication, even death, what exactly I was trying to say. So the death can be avoided in such complications with your good understanding and with the help of your doctor. So this was a bit critical, so that's why I have explained in a bit detail about respiratory system. So that was all for respiratory system. We'll come to the other part like brain. So psychological issues can be there in CP child, that is also very important, and those also can be managed with the help of your doctor. So we'll discuss it about psychological issues in next lecture. Till now, thank you so much. Take care of yourself.